The hospital authority expressed concern over increasing pressure on public hospitals. This comes as health officials expect a daily load of around 5,000 people to seek treatment at emergency wards in the coming days after the year-end holiday. Macy Mock reports.
Public hospital services are already hit by COVID infections and winter illnesses. The hospital authority expressed concern that it will face further pressure as more people are expected to seek treatment in the coming days. After the year-end holiday, the number of people waiting at accident and emergency wards might go up by 8,000, reaching 5,000 per day. Simon Tang, Cluster Services Director, said hospitals will increase temporary beds and speed up discharge procedures to shorten the waiting time. He said currently only a small number of patients had to wait for 12 hours before being admitted, but most still have to wait for 4 to 8 hours. Considering the long hours, the hospital authority has urged patients with minor symptoms to visit private doctors. New COVID cases dropped for the third consecutive day to 20,230, but COVID-related deaths have surged to 74, highest since April last year. Meanwhile, the University of Hong Kong estimated an even higher number of infections, reaching up to 150,000 to 200,000 people in the city caught COVID per day. Talking on a radio program, Jin Dong-yan, professor at the School of Biomedical Sciences of the university, said cases are not expected to rise drastically after the first phase of the border reopening with mainland takes effect this coming Sunday. But the epidemic has become endemic, he said. However, care homes are facing another challenge due to a new government rule. Grace Lee, chief executive of Our True Nursing Home, feared that staff in care homes could get infected, as triple-jabbed care home residents with minor or no symptoms are now asked to stay in nursing homes rather than holding centers. On the other hand, the government warned people not to stockpile drugs containing paracetamol and assured that there is enough stable supply of medicines to relieve pain and fever. Macy Mock, HKIBC.